All right, we're gonna start the meeting. I'll call it to order at 9:42. This is Friday. What is this, June
No, fifth.
fifth?
Fifth.
This is the legislative committee meeting for PABEA. All right, so Caroline's gonna take roll call.
I will do roll call. Okay, Poki'i Balaz. Okay. Bill Kanaka, we know he didn't, Stephen Lund. Stephen absent. Shelley's here, Susie. Okay. Marilyn did tell me, we spoke 2 days ago, she wasn't able to make it. Barbara Service, I see you. Hi, Barbara.
Morning.
Gary Simon. Present.
We're in Japan.
Wait, 5. Is that? Yeah, 50%.
Okay, but we have quorum.
You have quorum.
All right. So hearing quorum, is that everybody?
50, I should know
No,
this.
we only need 2.
Yeah.
Oh, we only, oh, that's right. You know the bylaws. You're very good.
Yeah, yeah.
Only need 2.
Okay,
Quorum. Yeah.
so called to
For the
order
meeting.
at.
The subcommittee, yeah.
2 p.m.
Okay.
Okay.
Has everybody had a chance to look at the minutes from May? Everything look good there? Okay. So hearing no changes, we'll ride with that. Okay, so old business. So legislative session, as you know, wrapped up on May 8th. And things have been sent to the governor's office. Christina's done a nice job of putting things in here. We'll just go through the list of where the bills are ended up being at. So right now, they're on the governor's desk. And what did I read? He has till June 30th to decide what if he's gonna veto anything, right? Until June 15th to sign things.
Yeah.
If he doesn't do anything with it, it just automatically
Plus,
passes.
he's
You probably
here.
know all that, yeah? Okay.
Susie's here. I put her as present. Anyone else that came in?
Stephen just joined.
Stephen, great, okay.
And Susie Schulberg just joined us.
Yeah, I got Susie, thanks.
Welcome, guys. All right, so we just passed the minutes. And just went through kind of the timeline for governor to sign, since she's just signing back in. Governor has till June 30th to note, or actually until June 15th to note what he's going to veto. And then if he doesn't veto, or if he doesn't sign, it just automatically becomes a bill. Okay, so I'd imagine there's gonna be some signing ceremonies coming up that we'll hear about as time goes on. So Christina did a nice job kind of recapping. So I'm gonna stick really right with the list here, what we have. Caroline, is there anything you want to add before we go into that?
No, go ahead, you can.
So just
Yeah.
if you have a question, please state your name and then the question. Okay, so raise your hand and then Jason will cue us that you have a question, or raise your hand, but make sure you state your name and then the question. And we're gonna stick with sunshine law, so we're just gonna stay with what's on the list here. Okay, so
Point of
question,
order, please.
name, please.
Sarah, the, under old where's our agenda? So shouldn't we be talking about this paper and not this, whatever the Kapuna caucus bills are? These are the ones that EOA, that we were interested and we were
Yeah.
supporting.
So for point of clarification, this is the agenda that was
I
submitted.
understand that, and my question is, why, I was asking, why are we discussing what was the Kapuna caucus bills instead of the ones that we had agreed and to support? Which are not always the same, some of them are, but many of them are not listed in whatever the Kapuna caucus was doing, since this.
I think you're okay, you could do the
Yeah.
attached
So
too.
why don't we
Yeah,
go through what's on
Yeah.
our agenda here,
yeah.
and then we can go to that list, Sarah. Good point.
That is a good point, but see, it
Because-
says see attached,
So
Sarah,
that's the
on the
attachment.
agenda, so the attachment does become part
Yeah.
of the agenda.
Okay, so I'm just wondering why we're discussing the Kapuna caucus bills and not just the ones that we are interested
Because
in.
we supported the Kapuna caucus bills. So what ended up on our agenda are the Kapuna caucus bills to start with, because that's what we supported as PABEA. We voted for all of those. And then we can go to this attachment for the rest to make sure we cover it. So please, let me follow the agendas to make sure I do follow that, and then we can go to the attachment like it says in the note. Okay? It's all
I
there.
think it's kind of a waste of our time, actually, but that's just my opinion. Okay.
Okay, others, what would you like to see happen? I'm just the chair.
We don't have a choice. Go through the agenda.
That's what I'm saying, right?
Yeah.
All right, thank you, Gary.
Hmm.
So when the agenda is actually written and is posted, that's what we need to follow. We do have an attachment, and then we will go to the attachment. So that's what Christina and I wrote up and how we wrote it up. So, and she beautifully did a great job of this attachment, which was, she's done this after we did the agenda, before it was posted, so it's very helpful. Because things were still unfolding. So just a note, Christina had a medical emergency and she's out. We did this a while ago, to give her time to do that.
Yeah.
So I have to go by how it is set up.
And I brought that up in the last meeting.
Well, again, we were dealing with some other stuff, so this is what we have. So the first one that's on our list then, just to move on here, caregiver tax credit. So that's HB 1972, and just to go cut to the chase, that one died in conference. Okay.
Sure.
So the second one, so Kapuna Aloha, HB 1973, establishing within the Department of Health 1-year Kapuna Aloha pilot program. That one passed, and that's gone to the governor's office. Okay. So Sarah, to save time, I'm just gonna go through fast, and then we'll go over to the attachment. So if you have questions, let me know. The hearing loss state plan, 1974, that one actually passed. SHPTA is gonna follow that. So that's kind of exciting. So the plan there is to come up with what the needs are, and then hopefully for next year, be able to propose some things that we need to work on. The first responder dementia training, HB 1976, that one died in conference. And we've been working on that one for a while. Long-term care financing. So that one passed, that went to the governor's office. That requires the Executive Office of Aging, right? So Caroline, if you want to talk about that one.
Yeah, so we're gonna be working with IUH on this and already starting the discussions so we can get that contract executed and swiftly, because it's a quick turnaround time, right? We have to report back to the state legislature and third week in December. So yeah, this one's gonna quickly, but it helps to really keep that conversation going, and I do appreciate everyone's support, so thank you.
Some of the work has already been done. Right?
Yeah.
So,
Yeah.
yeah, more of just a refresh.
Yeah.
Okay.
So that should go through the governor's office and it should be fine, yeah?
Oh, can I add one thing?
Yeah, please.
I did, because we have to put in our comments and recommendations for all the different bills, this was one of many, right? I'm actually asking them to sign it sooner than later if they can get that in the queue so we can get it signed off. Yeah.
Good idea.
Yeah.
Okay.
That was for the long-term care.
Yeah.
Good.
Yeah.
Okay.
So then the cryptocurrency, there's quite a bit of stuff here. Gary, Audrey, I see you both here. Do you want to talk about that one real fast? Those 3 bills?
Sure. So just as it says, the first 2 died in the vehicle. Is the one that bans, the one that came out of conference and was approved and forwarded to the governor's office is the one bans kiosks that accept deposits, cash deposits. So
Okay.
that's it in a nutshell. Anything else to add, Audrey? Well, it's all, and we're we're strongly advocating that the governor sign the bill. So that's underway. Anything else to add, Audrey?
No, that's basically correct. It just bans the deposits. People can still withdraw from it, but they can't deposit anything. in the kiosk. Thank you.
All right, thank you.
Thank you.
Capuna Rent Supplement Program, so that passed. So that repels the sunset date for the state rent supplement. Who was working on that one? Was that you, Gary?
That was Sarah.
Sarah,
Yeah.
right? Okay, you wanna talk about that one a little?
No, it's just that, it's been passed on.
Yeah.
This is a good
That's
C
a good
one, I'm
one.
happy with
Finally.
it. Yeah.
Okay. So. Why don't we go to the attachment then and see what ones we didn't talk about?
Well, the budget bill,
You wanna do any of those, Caroline?
you know, it was a hard year, right, for, I think, the legislature, because they had so many competing priorities, and then, of course, House Bill 1800, which is our budget bill. I think that one's already been, I think that one's been signed into law already, but, they were looking, I think, when it went to Ways and Means, they were looking at things like, do they, with the vacancies, could there be cost savings there and stuff? So we did not have any, we took a little of a budget cut, but we did not lose any positions. So I'm grateful for that, because we do have vacancies. So I know that was being reviewed. But all in all, I mean, it was an okay year for the budget.
All right.
Yeah.
Those next ones we did, so what's the next one we haven't covered?
Carolyn,
Oh, Emory Network, I
Oh,
can
hold
speak
on.
to that one.
Barbara, are you?
Carolyn, the governor said the other day, yesterday, I think, something about the state budget and that he might have some line item vetoes, but you're saying he signed it?
Oh. I thought I saw something, but I could be wrong, Barbara. I
Yeah,
thought-
me too.
Yeah, so I am probably incorrect. Apologies for that.
Okay, thanks. I'll check it out.
So one that we didn't actually hear in PABEA vote to support, but Barbara and I were doing stuff with Alzheimer's associations. That's the Hanai Memory Network Program. So that actually passed. That's kind of a big deal. That's $3 million a year to do. So really it's to help rurally help with diagnosing Alzheimer's. I think they're back now, but they were in DC. A lot of Alzheimer's folks trying to push some federal dollars through to actually get the blood test covered by insurances. So it's ASAP was the name of the bill that they're working on around that. But the Hanai Memory Room, that's pretty exciting. So that, yeah, go ahead, Sarah.
Sarah. This is the one where they proposed to have an office only in Hilo. And that the issue was Hilo is 100 miles from anywhere, the rest of the Big Island.
Yeah.
And that's nice for the people in Hilo.
So I'm not sure on the office space, because
You want me to speak to that
Go
one?
ahead.
Because I think as the bill was going through, I do remember this, Sarah. I think there was, depending on how much money was going to be available, they were trying to figure out possibly. So I think one version of the bill, but this CD1 that actually passed really is going to be for statewide, 3 million.
Yeah.
And so we're working with the Alzheimer's Association to identify, we really want to be able to have the concept in the clinics on all islands. We've already come up with, I will say it's our game plan. So we have when we need to get the procurements out and when we need to get these contracts going. So we have a whole lay of the land for that. So because it is a year, it's $3 million and we really got to get this moving. So that, I think the original one was if there was less dollars, they were thinking about Hilo. I do remember a conversation around that, but yeah, this will be statewide.
So as we went around, the legislators, governor, lieutenant governor at the time, the presentation was that we would use existing office space. And we're looking for specialists, but also
Right.
case managers. And so it was a whole kind of holistic approach that they were looking at.
My experience is that when we say the Big Island, it really means Hilo. Instead of when it's statewide, that means one in every island, which means Hilo and
Well,
not anywhere else.
Well, with discussions though, just to let you guys know, is that, we even were talking like, could somebody be more mobile in
Mhm.
very rural
Right,
areas?
that
And
would
so
make
it's
Yeah.
conversations we're
better
having
sense.
and
Yeah.
yeah, and that will all be hashed out in the
Well,
RFPs.
and just that, I mean, to that
Mhm.
point, that is how we presented it as our narrative to the legislators. That is a very mobile. And it's supposed to be, hopefully, I mean, within funding and space availability available everywhere. And the whole point is trying to make it
Mhm.
cover the rural stuff so people, so, and I'll stop with this, but what's diagnosed is maybe a third of what really exists out there, because most folks don't have a
Yeah.
diagnosis. And you don't know what you're dealing with without that diagnosis. Okay, what's this next one then?
Oh, this one's I love this one. This is, wait. Oh, no, this isn't the one I was thinking. I thought this was the one, this one is, for HIEMA to have a disabilities integration specialist, because we've learned over time during natural disasters or, you know, like the wildfires, that the disability community could really benefit from having somebody that really understands that population. So I know this was a real, we supported it. It was a real, big one for the, the Developmental Disabilities Council. I think they were the ones that, had it introduced. And it was a concept actually that, we had heard about, from some advocates on the mainland. And I remember they came into, so I think this has been in the works for a while, so I'm glad that this passed.
That's
And it's
great.
really to support that population with their special needs that they have.
I should
Can
probably-
I add something
Mhm.
with that? In last year's budget session for Maui County,
Mhm.
we pushed for a similar thing
Yeah.
where, Councilmember Kama, she created a proviso in the budget that at least one EP was dedicated to a position that did this.
Word.
But we still haven't seen that happen
Mhm.
yet. I think, so I would watch this
Mhm.
and see if it
Make
does
sure that it-
happen.
yeah.
So, and then I don't know what kind of assurances are in place, but that's something that we're gonna continue to watch
Yeah.
with our Commission on Persons
Yeah.
with Disabilities to make
We'll
sure
watch
that
this one too.
the position gets established. It's not just a regular, specialist position, and it would be great if we could have a disability integration, but make it an actual,
Mhm.
titled position.
Mhm.
So,
And it's
yeah.
persons on disabilities on your committee or council on aging, right? Because it crosses a lot of times, right?
Yeah, so the commission has pushed for that, but they don't take part in the meetings, but it would be helpful if, even if in every county had,
Mhm.
a specialist that
Mhm.
was, dedicated towards, disability integration or, vulnerable populations.
That's what I did in Seattle. So I had contracts to consult with all over the state.
Oh.
It's key. How about the next one? Dementia business.
No, I'm
Is that the
excited
one?
about all of them, don't get me wrong.
Yeah.
This next one, Senate Bill 2259, actually is a really good one because it's requiring DBED, our partners in this building, to establish a dementia-friendly businesses. So businesses can they'll take an hour training, their staff can take a training on how to make their business more dementia friendly, whether it's a restaurant that has a nice quiet corner for, a family coming in with someone with dementia. So we actually are working really closely with DBED on this because we told them, we're happy to be the back end of this. We can give you the materials, we can give you the curriculum, we can give you the logos if you want to use it so they can display it however the businesses want. Well, all we need DBED to do is mass distribute. They're the ones with the connections to the businesses, not EOA. We go in there, they're like executive office on aging, so I think
Yeah.
DBED is a perfect vehicle to disseminate. So we'll do the back end work. And then we're gonna ask DBED to just disseminate.
Right.
Yeah, so this one's a real good touchy-feely one. I really love this one.
And the next one, universal changing accommodations.
Okay, now I'm going to put my mom hat on. Thank God. Okay,
Alright.
this one is actually requiring public accommodations and public entity construction projects in the future to at least have a universal changing accommodation place. I mean, this is even good for
Adults.
elderly,
Yes.
for special needs, individual adults and stuff, because those little tiny ones that they have for the
Universal
babies.
design.
Yeah, it's
This is
all-
universal.
Yep. So this one's another really good one. And it just keeps people more engaged in their community, right? Instead of having to be, sometimes it's just an access thing and they can't get out because of things like this. So this is a real good one too.
Well, it normalizes,
Right,
Yeah.
you know, that this is what even grown-ups need, a changing area.
yeah. So it's exciting. I like that one.
And then SNAP.
Yeah, that's a good one too. This one was, let's see, did not follow this one very closely. Requires DHS to adjust the minimum certification periods for SNAP benefits. So I think a lot of stuff going on, at the federal level. There was a lot of, I think, what's the word I'm looking for? Awareness that, where does the state need to step in some of these areas? And that's what I think this one was about, is simplifying the application. And same with the Medicaid reimbursement rates. They increased them because I think over time, and they added an appropriation to ensure that, the reimbursement rates are comparable so people can, have that as needed. So
There
that's
was
a good
something
one.
in the paper, sorry, Sarah.
Yeah.
There was something in the paper this morning regarding the feds taking away money from Hawaii because
Oh, yes.
of the fraud.
Yes, the
and this-
Medicaid fraud. So, but then the state actually has let me find information on that. I read that article
Yeah.
yesterday and yeah, so.
They
yeah.
said that we didn't prosecute. So they're gonna punish
Oh,
the
hi,
people
Marilyn.
that most need that with $1 million cut for, and just with straight across the board because we didn't make a certain prosecution during a period of time. I mean, that is just, I just can't even, talk about that hardly. It's so makes me so angry.
Yeah.
So Marilyn, Emily, and Norma have joined us.
Oh, I didn't have Norma. I had Emily, but I'll put Norma
Okay.
down. Thank you.
I mean, basically, that's the first step towards them cutting all of our meds.
Yeah, it's gonna be so easy for them and we're not even thinking about the people that are gonna be hurt.
Yeah,
So stay tuned. That's
yeah,
hot news unfolding.
yeah. I was out yesterday and I saw it pop as a notification in my, that's scary because it's, I think, just the beginning of more to come.
Mhm.
Yeah. And I
So
think
building-
resolutions, and I am sorry, I can't really speak to most of these resolutions.
I can talk about the
because-
permit app,
Okay,
but
Okay.
I'm disappointed that, I'm glad it's there, but it's
Mhm.
urging the counties, which means you do this, okay? So, whether it will or not, it's to streamline applications for in case your parent is gonna move back home with you and you
Mhm.
need to change
okay.
the configuration in your house and add a this or that. And you need a permit.
Yeah.
That is to streamline that and make it sort of possibly even jump the line.
so
Sarah,
prioritize folks that have those things. Go
yeah,
ahead.
can I ask her a question? Do you know if there was a concurrent resolution or was it just a House reso and a Senate reso? Do you know?
I think it was two,
Okay.
maybe two, so, well, we can look.
Yeah, I'll go back and look. The only
Yeah.
reason I'm saying that is because usually if it's like a Senate concurrent or a House concurrent resolution, they're required to make sure. If it's just a HR or an SR,
Well, it's
Yeah.
urging.
yeah,
Urging is
I'm
not
gonna go back
terribly
and look.
strong.
Yeah. I'll see. That's interesting. Okay.
And then the second one below that is sort of the same thing.
Follows along with that. Okay.
And again,
That's the
it's,
So friendly, yeah.
Just for the recording, that's Kapuna friendly.
and it's talking about
Building requirement.
providing parking for businesses.
private businesses.
So the parking, I had a gentleman that looked me up that got a ticket for parking over the line. He was handicapped, and so I did some work with trying to get a bill. So the parking lots are, owners can decide which side they want to put the handicap on. And in his situation, the handicap was on the passenger side, but he needed it on the driver's side. And so it was at Windward Mall. So he parked and he got like a huge ticket. And so Annalisa Burgos, he was on the news, and they called me, and I went out to lunch with them and tried. So this is, the parking for handicap needs to be more universal and needs to be different than what it is right now in our state. Because it's up to the owner how they do it.
They don't have them for
They-
both sides.
No, they do one side. So I know when I was on the board at Hompa Honganji, and I would run the parking lot. It was crazy.
Or the one with, that you need might be filled already. So then you
Exactly.
go in the other one, right?
Yeah.
And it's not.
And you can't really
Yeah.
reverse.
Yeah.
Yeah.
So
So,
two questions,
What?
and I know this is like not our doing, but I'm just wondering, when we say kupuna friendly building requirements, it's actually age friendly or ability friendly, or I don't know what the term should be.
yeah. Well, and the parking is all ages, right?
Right, that's why I'm
Yeah,
like,
good.
Whoever drafted the
Right.
bill,
Yeah.
probably.
This is under
Sure, with
resolution
that.
though, right? So,
yeah,
Right.
I know,
but
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 still.
going forward, you're right.
Yeah.
Go ahead.
I have something to add. You know, with these two resolutions, I want to suggest that maybe, PABEA can make a decision, or if you want to make a recommendation to the entire
Yeah.
board to share these resolutions with the Council on Aging or advisory councils of each county.
That's a good.
Because for Maui County, just
Yeah.
speaking on behalf of them,
Yeah.
they're very interested in sharing recommendations or providing recommendations to the mayor. I know they're established to provide me, or the executive on aging with input regarding the area plan, but a lot of these issues do appear when we do our surveys and
And it's all
talk with the
advocacy,
community.
right?
Yeah, it's
Yeah.
part of
Good idea.
advocacy. So that would be my suggestion, is that you
Good
can talk
idea.
with PABEA, the whole board, and see if you can forward these resolutions onto the council and ask, because these involve county functions, like
Yeah.
planning department, building
Right.
department, so
Yeah.
that's
Yeah,
something that maybe
perfect.
that each county can take a look at.
Yeah,
Okay.
good idea.
Should we cover the ones that didn't make it? So caregiver tax credit.
Yeah, just list them, yeah.
Dementia training for law enforcement, so 10 years we've been trying to pass that one. Primary care providers, working group. Homeless report, homeless sanctuary pilot program, right, Sarah? Okay. I sent out the pick, stuff, finally, I sent it out early and then it actually came out. So there's been a huge, as we suspected, just on the pick real fast homeless. There has been a huge surge in Kapuna homelessness.
Yes, they're close.
And there's a huge increase in numbers of folks that are sheltered that are houseless, yeah, so. Those are two findings, okay. Any questions on any of those? Okay, so just going by our agenda here, new business. So there's nothing else, okay. Discussion next steps on bills that didn't pass for 2026 legislation session. So let me suggest that, just for sake of time, our next meeting, that we spend time talking about that and how we want to go forward as a committee. Is that agreeable to everybody? To look at like the homelessness, the bills that didn't make it all the way through, and start talking about this summer, what we want to do going into the next session. And some of the thought is, so I'm on a lot of teams, and we do go meet with legislators in the summertime in particular, just to talk about, what our interests are. And PABEA, we certainly could do that also if we wanted to. We could take time after our meeting to go over and meet with folks on a Friday, so you don't have to make a special trip out here. And especially with the chairs, And to kind of just see what, where they were at, why maybe a bill didn't pass, and maybe what else we could do, and what our passion is around it.
Schedule them to,
Come here.
Yeah.
Yeah,
What's an idea?
as part of our legislative, yeah. So we could do it here as legislative like we did at the beginning of last year. We could kind of do the same kind of format. And we could open the door for other folks from PABEA to join us
Mhm.
for that. Okay, why don't we think about that? So July, we have the 4th of July holiday, so the next PABEA meeting is July 10th.
10th, right? Yeah.
Do we want to meet on the 10th that morning? Legislative and have more discussion?
Oh,
Or do you want to go ahead?
my apologies.
Is that, are we doing that?
No, I think,
You're not doing the 10th, right?
no, we are doing the 10th. We're doing PABEA orientation that day.
Oh, okay.
However, just the recommendation though is before we know it, we're gonna be back in ledge session, right? It just comes, these months just fly by, right?
Yeah.
So, is it that, do you wanna wait till August? Do you wanna schedule a meeting sometime in July?
Yeah.
That's totally your guys' decision.
And that
I'm
is,
just letting you know
that's the
that.
question today. Should we
yeah.
take July off? Do America 250 and take a break and come back in August? Or do you think if we came back in July and focus our agenda on what we want to do going forward, that would be a good use of our time? We can take a break, but we don't have to. I mean, what?
Just for my personal, I'm going to be out of town, Rick. So
Okay.
whatever you all decide.
Some people will be traveling, yeah.
Yeah.
Barry, Barbara, what do you guys think? Chime in
Well, we'll know what the governor signed and didn't.
by then, yeah.
Mhm, that's true.
Yeah. So this next July, possibly July meeting would be to discuss the process of how you want to move forward on.
Well, it's up to us to decide what we want to discuss if we did meet,
Okay.
and this is a good time to do that
Yeah.
discussion.
Yeah.
So, if we wanted to take the time to do that in July, on July 10th in the morning, we could, and we could work that out. You could certainly, and please do send me what you think. I mean, you don't have to make a decision right now. Today is to decide, should we meet? And if we did meet, what do we want to discuss? Or should we take a month off? Because we can. But like Caroline said, it does move fast. So,
Quickly.
and I mean, we're coming for PABEA anyway. So if you wanted to meet, we can. But if you wanted to,
Well, just remember though,
Come later.
everyone will be in orientation prior to PABEA, so you're gonna have to pick it. If you guys do meet in July, you'll have to pick a different
a
day.
different day.
Yeah.
Oh, what time? I'm sorry.
Oh, I'm so sorry, Chair.
It's gonna be 9:30.
Oh.
Oh.
In place of committee meeting, we're going to have an
But
orientation.
Caroline, are you saying we're not meeting in July, or there's not going to be a PABEA meeting July 10th?
No, there will be.
It's an orientation at
PABEA
9:30.
meeting. Yeah, right. PABEA meeting and then the orientations prior to the PABEA meeting starting at 9:30.
Oh,
Yeah.
Yeah.
so if we met on July 10th, I mean, we couldn't
don't
meet
need to meet.
until on July 10th. Okay.
Right.
So would everybody be okay? We don't meet in July because we'd have to come up with a different date. And we'll just
And
go
that
with
may
the
be hard for
orientation,
people.
and then we'll meet the first Friday in August.
Unless
Okay.
you want to do an all Zoom
Yeah,
in July.
yeah. Okay. So I'm leaving it up to you all.
Someone would have to make a motion. Oh,
So-
so they want a meeting.
Okay.
Yeah.
So let me suggest, does somebody want to do a motion that we don't meet in July? Or the other way?
Barbara.
Barbara's gonna motion that.
Yeah,
Yeah.
I'll make a motion that we do not meet in July.
Okay.
I'll second the motion.
And Stephen
Thanks,
Lung,
Derek.
so Barbara motioned and Stephen Lung seconded. So all in favor of not meeting in July? Aye,
Aye.
Hey,
okay. Anybody dead set on meeting in July? Okay, hearing none, no meeting in July.
Okay, got it.
So our next meeting then, I'll go to my calendar real fast, will be August
Is it the 7th?
7th. So August 7th at 9 o'clock will be the next legislative, or 9:30, I'm sorry. You know what, so I get mixed up with RAC. Cause
Yeah,
I have
you
RAC at
never know.
9 and I get, yeah, so. So
Okay,
9:30, August 7th is the next PABEA legislative meeting.
okay, got it.
Okay.
Okay.
There was no public testimony, yeah?
You know, if it's so,
Okay,
Okay.
you guys know what you'd like to see.
all right. I was just gonna qualify, so I'd said I'm on the HONSAC, I am the Honolulu Subaru Health Plan Council. So it turns out the committee that I'm on, we finally started meeting, is just for Oahu rural. And the reason I wanted to bring it up here is to clarify that, but also, so that's the initiative, is $189 million the governor arranged for to come to help with rural health in Hawaii. And I wanted to bring it up in here, and if you don't, as part of, if folks are interested in their area, their counties, and being a part of it, they're looking for folks to join the committees. And our role there is to help give feedback on just what you guys have been giving feedback all along. What do you think is needed? Because there's money coming in, and it's a window, there's a short window as to when we need to actually implement things. So, and you join the HONSAC, so just same way that you joined PABEA, it's on the same web link, it's one of the selections, okay? So I just wanted to put that in there, and I already mentioned points in time. So with that, anybody else have anything else that's on the agenda? So we are gonna adjourn at 10:18,
Got it.
and we'll meet again in August. Thank you, everybody. See you at noon for PABEA. Yeah,
I want to talk to you this week.
Okay,
I want to show you the bowls. Oh, okay. The bowls. Yeah, I'll come back to you.
everyone wants to see the bowls.